RSV, or respiratory syncytial virus, has symptoms that are similar to the flu, and Valley doctors are seeing a surge in young children getting sick. Dr. Badrinath Kulkarni, pediatrician with Community Health Partners, explains why RSV cases are on the rise and what you can do to protect your children and family from this virus.
RSV is a little bit more dangerous than just common cold virus because there is a significant number of infants dying from RSV every year. It gets into the human system by nasal passages and oral cavity by touching from hands into the nose. And then it infects the upper airway system and stays there for several days to weeks in the body.
RSV can even mimic symptoms of the common cold.
It is very difficult initially because the first few days the symptoms are the same. Basically, it's like runny nose, congestion, coughing. In adults, it's very difficult to tell, and unless you do a testing. But it is a little bit more dangerous and it affects the little children more than the adults. Whereas in children, they have specific symptoms where they start having symptoms like wheezing, difficulty breathing. The younger they are, the much worse the children will have the symptoms.
Although there is no specific treatment for an RSV infection, Dr. Kulkarni says children with mild symptoms can take over-the-counter medications to find temporary relief. More severe symptoms may require a visit to a pediatrician.
Cough, cold medications, if they're sneezing, if they have congestion, if they have a fever and headache, they can take Tylenol or ibuprofen. And if they have any respiratory symptoms, especially if they are coughing too much, they cannot sleep, they're having cough-induced vomiting, they're wheezing, then they have to see their doctor to make sure that they might need inhalers and extra medications for support.
Doctors recommend adults keep wearing masks and washing their hands to stay safe in public, and if your child is experiencing early symptoms.
I would suggest people, especially parents, to clean their children's noses, suction them, use a humidifier, and hydrate them as much as they can. The major source of little infants getting RSV is toddlers. Keeping toddlers away from little infants might be very difficult, but still having them wear masks when they come close to the baby or when they hold the baby and washing their hands will be helpful.
Dr. Kulkarni recommends seeing your doctor immediately if symptoms persist or get worse after 2 weeks.